Okay, so today in pediatrics, I'm going to talk about integrated management of childhood illness, IMCI. So you might have heard of IMCI before, and when it comes to IMCI, integrated management of childhood illness, this is a tool which you can use to manage a condition at a clinic level. So when it comes to IMCI, the first thing that you need to know is that they are what are known as general danger signs, and they are what are known as the main symptoms. So these are what are known as the general danger signs, and these are what are known as the main symptoms, which have been stated in the IMCI booklet. So when it comes to the IMCI, when it comes to those symptoms, each symptom is going to lead you to a particular condition depending on the supportive signs that have been presented in this particular child. You'll find that maybe in the scenario, especially if you're answering a question, they will tell you to say this child has presented with fever, but apart from fever, there's also fasting breaths, maybe of 50 breaths per minute, about 50 breaths per minute. So you find that because of those, the main symptom of fever and supportive signs, it may lead you to a particular condition. So I'm going to talk about those more in details. Okay, so when it comes to the IMCI booklet, I'll start with the general danger signs, which are cardinal, and you need to know this. So when it comes to the general danger signs, there are 5 of them. So let me just increase this in size. So when it comes to the general danger signs, these are the general danger signs that we are talking about. So these are the general danger signs that we are talking about, and we are saying the general danger signs, there are about 5 of them. So according to IMCI, there are 5 general danger signs. The first general danger sign is saying, is the child able to drink? Meaning once the child comes to your screening room at a clinic level, you need to ask the mother what the child's problem is. So the mother may tell you to say maybe this child's problem is fever. And then you need to ask again whether this is an initial visit or this mother or this woman of yours is coming for a subsequent visit. So in terms of a GNC or General Nursing Council of Zambia question, you'll find that in a scenario question, you're going to be given answers. It is up to you to organize those answers, and these answers are going to lead you to one particular problem or condition, and then you pick the treatment just like that. So the first thing that you start with are the 5 general danger signs. Once you're given that information, that is why when it comes to the general danger sign, we are saying the first thing that you ask is, this child able to drink or breastfeed? If the child is not able to drink or breastfeed, meaning whatever form of the condition the child has is the severe form. If they have a fever, meaning that this child may definitely have severe pneumonia or a very severe disease, because this child has this particular general danger sign being accompanied to a main symptom that the child has presented with. Apart from that, the other general danger sign that you need to ask is child vomiting everything. So you need to find out if the child is vomiting everything. And then the third general danger sign is history of convulsions. Apart from history of convulsions, you need to also ask if the child is convulsing now. So the mother may say this child had experienced a convulsion maybe 3 weeks ago or a month ago, or the child may be convulsing at the time of assessment. Then apart from that, the last general danger sign, or the 5th one, is child lethargic or unconsciousness, or unconscious in other words. So these are the 5 general danger signs. So when you have gone through a question for IMCI, you'll find that the question may have asked to say state 5 general danger signs according to IMCI. These are the 5 general danger signs that you are requested to put. But if you are working at a clinic level, these are the 5 general danger signs that you also need to find out if this child is brought to your ward with a particular symptom or problem. So before I talk about the details of these symptoms, I'm going to talk about the symptoms, about 6 major symptoms which have been stated and mentioned in IMCI. So the first symptom that has been stated in IMCI is cough or difficulties in breathing. So in this particular case, you'll find that the scenario may say that this child has presented with a cough or difficulties in breathing. But this cough or difficulties in breathing, sometimes it may be accompanied with a supportive sign, meaning it is going to lead you to a particular classification. And according to IMCI, if you look very close here, so if you look very close here, you find that according to IMCI, cough or difficulties in breathing can lead you to different classifications. So according to IMCI, it says a child who presents with a cough or difficulties in breathing, this may lead you to the child presenting with severe pneumonia, or the child presenting with pneumonia, or the child may just have a cough or a cold, if at all the child comes with a cough or difficulties in breathing. I'll talk about the details of how cough or difficulties in breathing, or how you may identify or know that this cough or difficulties in breathing is leading me to one of these classification. But apart from that, we can talk about the other symptom. Apart from that, apart from cough or difficulties in breathing, the other symptom that has been stated in IMCI is fever. Okay, we can go to the next one, which says diarrhea. So the other symptom that has been stated in IMCI is this one here, which is the diarrhea. So according to IMCI, again, it says when a child presents with diarrhea, this diarrhea of this child may lead you to dehydration, or if the diarrhea is present for more than 14 days, it may lead you to diarrhea itself. If the diarrhea is mixed with blood, meaning this diarrhea that the child has may lead you to dysentery. So according to IMCI, these are the forms through which diarrhea may lead you to different classification depending on the supportive signs that the child has presented with. The next symptom stated in IMCI is fever. So we have talked about 3 symptoms now. The first symptoms we said cough or difficulties in breathing. The next symptom we said diarrhea, and the third symptom that we are talking about is fever. So according to IMCI, again, it says if a child presents with fever, this fever may lead you to malaria, high risk malaria, meaning in the scenario they may tell you to say a malaria test is confirmed positive, meaning this malaria may lead you to high risk malaria or low risk malaria, or the fever that the child presents with may lead you to measles. That's if the child presents with any supportive symptoms of measles. And we'll talk about the details of that later on. Apart from that, the other symptom stated in IMCI is the ear problem. And according to IMCI, it says when a child presents with ear problem, it may lead you to mastoiditis. Apart from that, acute ear infection or chronic ear infection or no ear infection. Then also according to IMCI, the other symptom or major symptom stated in IMCI is malnutrition. So when it comes to malnutrition as well, according to IMCI, it says the child who presents with the malnutrition, this particular classification may lead you to different classifications such as the child coming in with malnutrition, such as severe malnutrition, very low weight, or not very low weight. Then in terms of anemia, it's according to IMCI, again, it says a child who presents with anemia, this may lead you to severe anemia or no anemia at all. So these are some of the 6 major symptoms that have been stated in IMCI. So when it comes to a GNC, General Nursing Council of Zambia, or nursing, because it has been changed to Nursing Midwifery Council of Zambia. So when it comes to a Nursing Midwifery Council of Zambia question, if they are going to give you a question for IMCI, you'll find that this question is going to have answers in it. So it will be up to you to know the IMCI booklet. And when this question has answers, you need to write the management, which will say, write the classification, assessment, write the assessment, classification, and treatment of baby what according to IMCI. Meaning you need to have this booklet with everything in it in your head, because IMCI, you cannot guess the answers if you don't know what is stated in the booklet itself. So I'll now go ahead to explain the details of the first symptom, which is difficulties in breathing or cough. So after we learn about the IMCI booklet itself, then we can now use questions, how questions are structured, and how you can answer such a question for IMCI. So according to IMCI, the first symptom is cough or difficulties in breathing, meaning if this child comes with a symptom of cough or difficulties in breathing, the first thing that you need to ask is, okay, let me just increase the font so that you may be able to see. So according to IMCI, it says you need to assess for the following if a child presents with cough or difficulties in breathing. Okay, so when a child presents with cough or difficulties in breathing, it says you need to look, listen, as well as feel. So you need to count, first of all, the breaths in 1 minute. You count the breaths in 1 minute and count the amount of breath that you're able to notice whether it's within the normal range or not within the normal ranges. Then apart from that, it says you need to look for chest indrawing. You need also to rule out striders or if there is wheezing. So again, I'm repeating this. If a scenario comes for IMCI, if they say this child presents, maybe they say baby whoopee, aged 6 months, has come to your clinic with the symptom of cough and chest indrawing. So they are going to have answers for you in the scenario. And then the management question may be, manage baby whoopee by assessing, classifying, and treating the child according to IMCI. Meaning you already have the answers. It's up to you to organize those answers, and it may lead you to one of the classifications according to the cough or difficulties in breathing many symptoms. So according to IMCI, again, it says when a child presents with a cough or difficulties in breathing, how would you classify this cough or difficulties in breathing? So the first thing that IMCI says, if the child presents with cough or difficulties in breathing, and this cough or difficulties in breathing is being accompanied by any presence of any general danger sign, meaning amongst the 5 general danger signs, this child can present with any of the general danger signs, such as we talked of child not able to drink, difficulties vomiting everything, convulsing, lethargy, unconsciousness, as well as convulsions at present. Meaning if the child presents with any of the general danger signs, and these general danger signs are being accompanied by either chest indrawing or striders, meaning you need to classify the cough or difficulties in breathing that the child has presented with as the child having severe pneumonia or a very severe febrile disease. So I'll repeat this statement again. According to IMCI, it says if the child presents with cough or difficulties in breathing, you can classify the cough or difficulties in breathing if it is being accompanied by the presence of any general danger sign amongst the 5 general danger signs. And these general danger signs are also being accompanied with chest indrawing or striders, meaning you classify the cough or difficulties in breathing as severe pneumonia or a very severe febrile disease, and the treatment is here. So we'll talk about the treatment at the end. So this is the first classification. Okay, then apart from that, according to the same IMCI says, if the child presents with the same cough or difficulties in breathing, but this cough or difficulties in breathing is being accompanied by fast breaths, meaning you are going to classify the cough or difficulties in breathing as pneumonia. So how would you identify or know that this child has the fast breaths? So again, according to IMCI, it says you can classify fast breaths as the following. If the child is aged between 2 months up to around 12 months, if the child presents with 50 breaths or more in 1 minute, meaning you're going to classify those as fasting breaths. If the child is between 12 months but below or up to 5 years, and the child has 40 breaths or more per minute, meaning you classify those as fast breaths. So according to IMCI, it says if the child comes with a main symptom of cough or difficulties in breathing, but this is being accompanied with fast breaths, meaning you're going to classify these fast breaths as pneumonia. And according to IMCI, again, it says if the child presents with no signs of pneumonia, meaning you're going to classify the cough or difficulties in breathing symptom as just a cough or a cold. Meaning in the scenario question, you'll just be told to say this child has just presented with a cough or difficulties in breathing, and there's no accompanying sign of this cough or difficulties in breathing, meaning your classification is just going to be a cough or a cold. So this is how you classify the main symptom of cough or difficulties in breathing according to IMCI. And the treatment, you're just going to pick the treatment as stated in IMCI. So in this particular case, for severe pneumonia, it says in the pink row for severe pneumonia, it says you give the first dose of an appropriate antibiotic. And in this particular case, I would do think the appropriate antibiotic that you would use or that may be used is amoxicillin. So you may prefer giving amoxicillin maybe 1.5 milligrams as a start dose, and then you urgently refer the child to the hospital. Then apart from that, according to IMCI, it says if in the pink row the child presents with pneumonia, meaning the treatment is if there is presence of wheezing, you need to give a bronchodilator. Apart from that, give appropriate antibiotic. Then you need to soothe the throat with self-remedies so that the child's frequency of coughing is relieved. Then apart from that, if there is coughing for more than 3 weeks, you need to refer the child for assessment for TB or asthma. And then you need to advise the woman when to return immediate. And then you need to follow up the case in 2 days. So you have seen that the treatment for IMCI is specific. When we talk of conditions like maybe let's say croup, you'll find that there will be specific medical treatment or drugs that you're supposed to give. But for IMCI, you cannot guess the treatment if you have never read about the IMCI booklet itself, or if you don't know what is even stated in the booklet itself. That is why it is important for you to know the IMCI booklet, because you may also need it if you're working at a clinic level, and this is how you may need to manage conditions at a clinic level. Okay, so we can talk about the next symptom. So the next symptom is talking about diarrhea. So according to IMCI, it says if the child presents with diarrhea, and this diarrhea is being accompanied, and this diarrhea, for example, is being accompanied with the lethargy, and this diarrhea is being accompanied with lethargy or unconsciousness, and there is also sunken eyes, meaning the child should have 2 of the following symptoms that or signs that I'm going to mention. So the first thing, the child should have diarrhea. But apart from diarrhea, this child is lethargic or unconscious. Apart from that, the child has sunken eyes, or child not able to drink or drinks poorly, or a skin pinch goes back slowly. So according to IMCI, it says this diarrhea of yours is going to lead you to dehydration. And this dehydration has, again, 3 classifications organized through pink row, the yellow row, as well as the green row. So in the pink row, it says if the child presents with any of these 2 of the 4 signs mentioned in this row, you should classify the child as having severe dehydration and give the appropriate treatment as stated in this particular booklet. Then apart from that, it says if the child presents with diarrhea, But this diarrhea has also the two of the following signs, such as restless or irritable, sunken eyes, drinks eagerly or thirsty, or skin pinch, goes back slowly, meaning you need to classify the type of dehydration as SAMU dehydration, and you give fluids according to Plan B. Then, according to Imci, it says if there are no enough signs of dehydration or severe dehydration, meaning you are going to classify the child as having no dehydration, meaning in a case where the child just has diarrhea with no other supportive signs mentioned in the scenario or being presented with this particular child, meaning you are just going to classify the type of dehydration that the child has as just no dehydration, and you give fluids according to Plan A. Then apart from that, the same IMCI states that if the child presents with diarrhea, but this diarrhea is present in this particular child for more than 14 days, meaning you're going to classify this type of diarrhea as diarrhea itself. And in the pink row, it states that you can classify diarrhea if it has been present for more than 14 days, and there is presence of dehydration, meaning you classify this diarrhea as severe persistent diarrhea. But if the child presents with diarrhea and this diarrhea has been present for more than 14 days, but there are no signs of dehydration, meaning you are going to classify this diarrhea as just persistent diarrhea according to the yellow row. Then the same IMCI states that if the child presents with diarrhea and this child and in this diarrhea there's presence of blood in stool, meaning you're going to classify this type of diarrhea as dysentery. So if there's blood in stool, meaning you classify the type of diarrhea as dysentery, and the appropriate treatment is to give ciprofloxacin for about 3 days, and you follow up the case in 2 days. So this is how you can classify the symptom of diarrhea according to IMCI, and that is how it may help you or it may lead you to different classification depending on the supportive signs mentioned in the booklet itself. So we can move on to the next symptom. So the next symptom is talking about fever. So the next symptom is talking about fever, which is our third symptom. So according to IMCI, it says if the child presents with fever, and if the child presents with fever, that's if the temperature is above 37.5 degrees Celsius, you may need to classify this fever as the high risk malaria, low risk malaria, or the fever may lead you to measles. So how can fever lead you to high risk malaria? Meaning it may come out when you may do a malaria test, or in the scenario they may tell you to say a malaria test was done and it came out positive, meaning this fever that the child has led you to high risk malaria because a malaria test has come out positive. Then if the scenario they have not told you to say RGT was done and was not done in short, but there is a symptom of fever and other symptom mentioned, meaning it may lead you to low risk malaria. But if the child presents with fever, but this fever is being accompanied with the mouth ulcers, or there is pus draining from the eyes, or clouding of the cornea, and the child has symptoms of measles, such as generalized rash, cough, or runny nose, meaning this fever of yours is leading you to measles and not malaria. So if the child presents with fever and the child malaria test comes out positive, meaning it will lead you to high risk malaria. So according to IMCI, it says you can classify fever as leading you to high risk malaria if a malaria test has been confirmed positive, and you can classify this fever as a very severe febrile disease if there is presence of fever itself. Apart from fever, there is presence of any general danger sign or stiff neck, meaning you classify the fever that the child has as a very severe febrile disease. Then apart from that, the same IMCI says if the child presents with just a fever or temperature of 37.5 degrees Celsius and above, meaning you are just going to classify the fever as just malaria and you'll give the appropriate treatment like that. Then the same IMCI says if the child presents with fever but a malaria test is not confirmed positive, meaning it will lead you to low risk malaria. But if this child comes has fever and presence of any general danger sign or neck stiffness, again it says you need to classify the fever that this child has as a very severe febrile disease. Then if this child presents with fever, but the fever is not being accompanied with any presence of a runny nose, there is no measles, and there are no other causes of fever, meaning you need to classify the fever that the child has as malaria. Meaning in the scenario, all you need to have is just a fever, temperature of above 37.5 degrees Celsius, and then you need to classify that fever as malaria and you give the appropriate treatment as according to IMCI. Then according to IMCI, it says if this child presents with fever, but this fever is being accompanied with a runny nose, there is measles present or other cause of fever, meaning you're going to classify the fever that the child has as just fever, malaria, unlikely. Then sometimes the scenario or this child may present with fever and also presence of generalized rash, meaning the fever that the child has is going to lead you to measles. So according to IMCI, it says if the fever leads you to measles because there's presence of generalized rash, meaning you can classify the fever as severe complicated measles according to the pink row. If the child presents with the fever itself, but this fever is being accompanied with any general danger sign, clouding of the cornea, or deep extensive mouth ulcers, meaning you classify the fever as severe complicated measles. Then apart from that, the same IMCI booklet, it says, if the child presents with fever and this fever is being accompanied with the pus draining from the eyes or mouth ulcers, meaning you classify the fever that the child has as measles with the eye or mouth complications. Then if the child has fever together with the generalized rash and this fever has no other accompanying symptom, meaning in the scenario they may just give you signs of measles to say this child has fever and generalized rash, meaning this child has fever now or within the last 3 months, meaning you classify this type of fever as just measles, and the appropriate treatment according to IMCI, it says just give vitamin A. So that is how you can classify fever according to IMCI. So we can look at other problems such as the ear infections, anemia, also malnutrition. So these are other symptoms that have been stated in IMCI and you need to know how to classify them. So for today, we are going to end on these 3 classifications, and be sure to join to look out for the next lesson for IMCI so that you can learn how to answer a question for IMCI if you're asked to answer a question, having learned the booklet itself. So we'll look at a question based on the 3 symptoms that we have looked at, because these are the common 3 symptoms, and then we will finish up the rest in details later on. But you need to learn how to answer a question for IMCI. That is when you're going to learn the booklet itself, or that's when you are going to remember how to manage conditions according to integrated management of childhood illness. So for today, we are going to end here, and next time we'll look at a question for IMCI. So thank you so much for taking time to go through this lesson. Till next time, and this is bye.